sitting at my table, I was thinking on the way over here that it has been, I do feel blessed today that as I wind down my speakers that I've curated this year and how generous everyone has been with their time, and just feel blessed that I have people like Christy in my network, and we were just commenting that we've known each other for going on 19 years now. So you don't always find former coworkers that you develop lifelong relationships with, but just love the fact that Christy and I have remained friends for this long, and thinking about the 49 other people that I signed up this year, and just very thankful for their time. So that being said, I am introducing my lifelong friend, Christy Arand, who is a lifelong Lancastrian. She is the Chief Development Officer at the Community Action Partnership of Lancaster. In this role, she works to fundraise and friend-raise, I like that, to support the organization's mission to end generational poverty in Lancaster County. In the past, she has held roles at the Lancaster Chamber, the Lancaster Barnstormers, and Lancaster Newspapers, where we first met. An active volunteer, Christy serves on the Board of Directors for the Pennsylvania Association of Nonprofit Organizations, or PANO. She coaches youth cheerleading for the Lancaster Recreation Commission, and she is a member of the Lancaster Chamber's annual dinner advisory committee. Start on time, end on time this year? Speaker show up?
Yep.
All the good things. She's a member of the American Lung Association's National Lung Cancer Caregiver Advisory Group, and in 2021, she was recognized as one of the Central Penn Business Journal's 40 Under 40 honorees. She graduated from Millersville with a degree in government, lives in Millersville now with her husband Adam, daughter Kyler, canine kids Sally and Lucy. Please welcome Christy Arand.
Thanks, John. It didn't seem that long when you were reading it, so maybe I should add some more things. He was
Sure.
giving me a hard time for how long my bio was.
I did not say it was a hard time. You said don't read it at all.
So. I did. But hi everyone, I'm Christy. I'm delighted to be here with you today. As Sean said, we've known each other for a long time, and just really excited to. I've also known Paul for, oh my gosh, 15 years. We met when I was at the Barnstormers. He was an usher, so it's a small community we've got here, and I kind of love it. So I'm just going to talk a little bit today about Community Action Partnership, our work in the community. I will take any questions, but first I just want to ask, kind of show of hands, how many of you have heard of Community Action Partnership of Lancaster or CAP? Wow, okay. Usually I go into rooms, so what this means is that me and my development team are doing a really good job, because when I started in this role, no one had ever heard of us. And so we have been around in Lancaster County since 1966, and community action agencies across the country started in the 1960s as part of the Lyndon Johnson administration. Really the thought during that time was that the poverty level in the United States was unacceptable, and President Johnson really wanted to figure out where the poverty was in the United States. And so he sent a gentleman out. The gentleman's name was Sergeant Schreiber. So if you're familiar with the Kennedys and the Schreibers, Sergeant Schreiber was the gentleman who did a tour across the entire country. And what Sergeant Schreiber found was that most of the poverty was child poverty. And so this really concerned the administration, obviously. And so community action agencies were born out of the Economic Opportunity Act. So if any of you are history buffs, just stick with me here, because I know for some people this can probably get boring. But the Economic Opportunity Act not only created community action agencies, it also created things like Job Corps, legal aid, it created the AmeriCorps program, and so there were a lot of things that came out of that legislation, and really started, what was kind of called the war on poverty. Now, the war has not been won on poverty. I actually, it's frustrating because I think we think about, well, we've been at this since 1966. Why have we not eradicated poverty? And it's interesting because I think as we look at the different types of poverty that exist, we think about generational poverty and we think about situational poverty, right? And so generational poverty is right, that child who grew up in a household that they were experiencing poverty, and they're, back then as they grow into adulthood and experiencing the same sorts of challenges. That's really the poverty that we're focused on alleviating. Situational poverty, I think, unfortunately, will always exist, because there are folks who are just kind of one car accident away from, needing help, or one medical bill away from needing help. So we're really focused on generational poverty. And so there are about 1,000 community action agencies across the country. And we all look very different. So, everyone says you've seen one community action, that just means you've seen one community action. Because really the only thing that we need to do to be a community action is have an anti-poverty mission. So I'm gonna go through just a couple of the different programs and resources that we offer here in Lancaster, so that you have an idea. Just basics, mission, vision, values. I was listening to your 4 promises. Four-way test. And interestingly, so we at CAP, we have about 15 different programs that we offer, but whenever we're looking to start an initiative, we run through what we call a strategy screen, which is very, very similar. Things like, is this ethical? Will this help people? All of those sorts of things. So I like that sort of similarity between the two organizations for sure. So I think the other thing that's a little bit interesting to look at is, like every organization, we have a strategic plan. We've done ours a little bit differently because we really want to ask ourselves some big questions and then answer those questions through our work, right? So the first is, how do we address race, power, and privilege in all of our efforts, whether that's with our staff, with our participants, or whoever that might be. Obviously community actions were birthed during the civil rights era, so this idea of equity is really important to us as an agency. The second is how we focus our programming on those efforts to transform generational poverty. So the first one, is kind of about equity, the second one is about programming, and the third one's really about our team. I think probably all of your speakers, if asked about workforce right now, would admit to some challenges with that, and so really want to be setting ourselves up to be a really great place to work, because we know that, especially in social services with burnout, folks really need to be well themselves before they can offer, any sorts of help to others. So CAP of Lancaster has 4 different, what we call impact areas. And so the first is health and nutrition. And so 4 programs fall under here. I'm sure everyone has probably heard of WIC, and that's one that, a lot of people have heard of when I ask them the question about knowing community action. So WIC is, breastfeeding support. It's also healthy food and money for healthy food to families sort of infancy to 5 years old, when the children are infants from 5 years old. And the great thing about WIC is they also do health assessments. So folks come in every so often, children's height and weight are checked. It's kind of making sure that the whole child is thriving and it's not just the food that we're offering. So the second program is our senior centers. We have 2 senior centers in Lancaster County. One is downtown in Lancaster City, and the other one is in Columbia Borough. Each of those are completely free to attend for anyone who's 60 and over, and do a lot of very cool programming. I think my favorite that I've seen so far is Wally the Support Alligator. Has anyone ever met Wally the Support Alligator? No, he's so cool. But he came to the senior center. They do, different performances, and they go on field trips, and so just sort of this idea of aging gracefully, aging in place, all of those sorts of things that primarily focus on low income seniors. Food distribution is the third. So CAP is actually the contractor with the county commissioners to be the lead on food for Lancaster County. So we actually serve kind of like in an Amazon capacity, where we serve 40 different food pantries across the county, with making sure that they get the food they need to then serve to their clients that come. So it's anywhere from generally 1.5 to 2.5 million tons of food that is kind of flowing through that network every year. And then the last one is nutrition education. So this is really about going into primarily schools, but really any community group to teach whoever, young people, all the way up to seniors about healthy foods, how to prepare those healthy foods, and maybe some alternatives to foods that aren't as healthy. So that is the health and nutrition team, and really our highest level of service. About 10,000 people every year are served through the WIC program. We serve about 40,000 people overall per year, so this team sees about a quarter of those folks we're serving. The second impact area is household stability. So really, it's a little bit of a catch-all, but anything that would kind of like take people off of their plan or track to prosperity falls under here. So something like utility assistance, we help low-income individuals with help with their PPL bills, with UGI, and then also we're contracted with Lancaster City to help with water. So really anything here that would get someone's home condemned is what we're helping with in utility assistance. And sometimes that's just getting folks on a payment plan or helping them with back balances, but working with the utilities to make sure that folks can have those services at their homes. The Early Learning Resource Center is subsidy for childcare. We all know, well, I mean, childcare is very expensive, but you can be paying up to like $200 a week for childcare. So what the Early Learning Resource does is provide subsidies for childcare for parents who are either working or in school, so some sort of educational program. And it's really done on almost like a co-pay sort of scenario. So based on someone's income, we determine what their portion of the responsibility is, and then we come around and provide the rest of the balance so that they can make sure to have their kiddos in childcare, because without that, they might not be able to work or go to school. And then our RISE program is pretty unique in that it is a case management program, but really long-term case management. So someone comes to us and says, hey, I have this goal, and it's maybe to go back to school and get my degree, or it's to get off of all these programs that we're offering to them. The RISE team really walks alongside them for up to 2 years in some instances, and helps with whatever they need. And it's a pretty unique program in that all the other programs that we offer have folks to help them with that specific thing. The RISE program really is like an umbrella that can help folks with anything that they need. Our safety and empowerment team is the third. So this is where our domestic violence services program falls, and also our Crispus Attucks Community Center. So domestic violence services, we are the county lead for that. We run a 24/7, 365 phone hotline. We also, during COVID, debuted a text line where you can get connected directly to an advocate just by texting someone, which is great. They offer a safe house shelter, which is open 24/7, 13 different units within that, transitional housing for about 10 families, a children's program, supportive coaching, and I think that's it. There's so much under the domestic violence services umbrella, but they're serving about 1,700 survivors of domestic violence in Lancaster County every year, and we know that there's a ton more folks out there that need that assistance. So really always a program that we're looking to build up and just gain more support for, because there is so much need. And then the Crispus Attucks Community Center is a recent addition to CAP's portfolio. It's been around almost 100 years, so 1927. It is a historically Black community center. It was really the place where, when folks were coming back from World War I, there was still a heck of a lot of segregation. This was a place where they were able to get services and were able to be in community, and it's really evolved throughout the years. It's been a boxing ring, it's been a community hub, it's been a homeless shelter, and so now the center really just focuses on food distribution. They have hot lunches twice a week. They do food boxes out of there. And then we also have a Young Professionals of Color network for folks who identify as BIPOC and want to get more involved in the community and civic education and things like that. And then finally, fourth, is our education and child development team. And so this is This team is the biggest of our CAP teams. We have about 300 employees overall who work for CAP. This team is about 150 of those employees because every Head Start teacher in the entire county is a CAP employee. We're the countywide lead on Head Start, and so that is early education for students ages like 6 weeks, I think we start. So that's primarily childcare, but 6 weeks up to 5 years. And so lots of different components there. STEM education is a big focus there, but again, these are all income qualified families, and so really the building blocks are happening in that Head Start Thrive to 5 program. We also offer parents as teachers, which is really cool because if you have kids, you know that they just like send you home with this child and you're like, okay, but what do I do now? And so the Parents as Teachers program is a home visiting program that goes into folks' houses and really teaches parents how to be their child's first teacher. That is one of the only programs at CAP that there's actually no income qualification for, so anyone can take advantage of those services. And then lastly is our First 10 initiative. So this is just what we found through research. Every 3 years as a community action, you're required to do a community needs assessment. And so we're constantly gathering that data, but also using that data to inform our work plan. What we were seeing is that childcare providers, not at CAP, but other childcare providers, weren't really talking to school districts, but we also know that the first 10 years of a child's life are the most important in terms of their education. So the First 10 initiative just really brings together early education providers as well as school districts to kind of make sure that that robust continuum exists so that students are set up the best way that they can be. We're also really diving into and this feels like an afterthought, but is probably the basis of our entire work right now, what they call a 2-generation approach to poverty alleviation. So really working with the parents and the child at the same time, because what you see from a lot of these programs is, you know, one is working with the parent and then another is working with the child, but really figuring out how to make that a continuum and work with the whole family, because we know if someone needs utility assistance, they probably also need things for their kiddos or we're seeing a lot more generational houses where grandparents may be engaged as well. So just with this 2-generation approach, really putting it over every single service that we offer and being able to serve that whole family. I think that's all I have. So does anyone have any questions about the work? Anything you can think of? Yes, hi.
So if it was established by the federal government, I assume, is that where most of the funding comes?
Great question, yes. So about 93% of our funding is federal or state, public funding. So our budget is right around $48 million every year, and most of that funding is fee-for-service work. So when you look at a contract like Head Start, it's a $17 million contract, which is all, they tell us how to use it, pretty much. Same with WIC, that's a big contract, any of these. So there's really only 7% of our total budget that we're able to use for unrestricted resources. So a lot with my role is trying to find those private resources to bolster the programs that we do have. Whereas Head Start, I'll give you just a quick example. So our Head Start team came to us in 2018 and said what we would really like to do is create the region's first STEM classroom for lower income students. Because while those services are offered to students with means, lower income students are usually left out of that STEM education. So we said, great, we found a location. It's a old dorm at Millersville that we actually completely redid into a STEM classroom. And so Head Start will pay for that, for the instruction, for the staffing and that sort of thing, but they won't pay for architectural renderings, they won't pay for the actual construction. So we did a very mini capital campaign, raised $150,000 so that we were able to provide the infrastructure for then the Head Start services. So I always like to just kind of explain to people how that looks and works, because if you look at our 990, you're like, well, they would never need money, and we're like, no, we definitely do. Yeah.
How are we doing?
It's a great question. So I think right now, for a long time, how I started any presentation was to let people know that Lancaster City's poverty rate was higher than Philadelphia, Pittsburgh, or Baltimore's. That is actually not the case as of this year. So, we have actually done a pretty good job of lowering that poverty rate. I think right now we're hovering around 19% in the city, and just under 10% in the county. A lot of the county poverty is very rural poverty, so a good deal of our work is figuring out how to get services out to folks in the more rural parts of our county. We have locations in Lancaster City, then we also have a hub in Columbia, one in Ephrata, and one in Quarryville. So we're doing well. We usually judge those rates by like 5-year estimates from the Census Bureau. What we haven't seen yet is COVID and what that kind of might have done. I mean, we know anecdotally that right now, food insecurity is higher in Lancaster than it's been for at least 5 years. So, you know, folks really struggling accessing food banks and accessing that free food a lot more. So I think we're doing well, we're connecting folks to services, but ideally we don't really want to need to exist in the community. We would prefer to just kind of shut our doors and not have to do the work, but we'll just see kind of what COVID does to those numbers. Yes.
Do you have a way of identifying new communities that need your services, for instance, Elizabethtown?
Yeah, that's a great question. So we, so back in the, I don't know, mid-2010s, the United Way was doing some work to fund community hubs, and Elizabethtown was one of those areas that had a community hub. I forget what it was called. The United Way has since sort of moved in a different direction with that funding, but these community hubs still exist. So there are, you know, a collection of services in E-Town and in Solanco, in Paradise, and so we partner with those agencies, but I think, you know, I mentioned food insecurity. One of the things that we're trying to get off the ground right now is a mobile food pantry that can literally pick up and go into any community that might not have access to, especially fresh foods, and be able to serve that community. So with that community needs assessment, that's really telling us where the need is and sort of hotspotting in Lancaster County. And then it's our responsibility to figure out, okay, so what services are needed and how can we get them there?
Thank you.
Yeah.
So Jill Arthur was here 2 weeks ago and very complimentary of you and CAP, talking a lot about food insecurity. What is your relationship with the Central PA Food Bank?
Yeah, that's a great question. So the Central PA Food Bank, as you all heard, serves 27 counties, and they're oftentimes the lead for food distribution in those counties they serve. So Lancaster is different in that, you know, we're the lead there. Most of our food pantries, what happens is, you know, we get the funding and then we divide it out based on need to the different pantries. Then they get it on an account where they can shop at the Central PA Food Bank. What was interesting during COVID is, well, not that COVID's necessarily over, but you know what I mean? During the height of COVID, even the Central PA Food Bank couldn't get food. Like, one of the things that they just could not get was cereal. It was this whole like debacle with being able to get cereal. So what we do at that point is privately fundraise to make sure we can go out to vendors, and then the pantries can source that food. So we're getting a lot of food from the Central PA Food Bank, and, you know, making sure that our pantries can get that too. And they did the whole hunger mapping project, you know, Hunger Free Lancaster exists, we're a member of that. And we were actually gonna enter into a grant agreement with the Central PA Food Bank to try and do some of this bigger picture work. It didn't actually work out for this year, but we do a lot of like co-work because it is so similar. Anything else? Great, well, thank you so much. Oh, sorry, yes.
A lot of what you do is working the need. And, but the need is created because something isn't happening upstream, to use a metaphor. So I like to think systemically and wonder what needs to change upstream so things aren't happening down here. And how, you know, if your energy is services, who's thinking about what needs to change upstream and how we do that?
Yep, absolutely. And so part of what we do is obviously advocacy work for policy change that would help. I don't know if anyone's familiar with the something called the cliff effect. It's sort of when someone starts making too much money to qualify for a service, but is still not, like, so they kind of fall off the cliff because they're still not at a family sustaining wage in their work where they can afford to live. And some of the programs have made changes in that. Some of them have a long way to go. But I think as we look at any sort of policies around family safety net, keeping families safe, having businesses that offer thriving wages, and offer other employee supports so that people can work. We've done a lot of work with Four Seasons Produce to kind of talk about how we can come alongside their employees who might be having problems with tardiness or problems with not coming to work or whatever it is, because they found out that if someone is consistently late or not coming to work, it's often a childcare issue. And so, then we kind of say, okay, well then, so what can we be doing to prevent that? But again, that does kind of get into services. I think when you look at the upstream, it's those policies that support families and individuals so that, people are able to climb out of poverty and it's not just a cycle that continues.
Do you have people that focus on the policy and advocacy and go to community and governmental
So
and
that's,
political places and?
so that's where that private funding comes in, right? Because none of the, unfortunately, like none of the programs we run has that in the budget to support that work. And so in that 7% of funding, right, we're able to fund what we call our chief strategy officer. She works on our advocacy agenda and meeting with legislators and really trying to figure out how that can look better. So it is something we focus on, not to the extent of like a central PA food bank, because we don't have the capacity and infrastructure to be able to do it quite yet as well as we would like to.
Rob, one last question. Do you have systems of evaluation for the various components? Like, sustainability and how effective is this and how do we measure it?
Yeah, so one of the things that comes along with this being a community action is that we have a lot of very, a set of data that we need to report every year to the federal government on exactly what you're talking about. Efficacy, number of people served, what their incomes are looking like. Because a lot of it, I think a lot of it is, how to say, providing those critical services. There's not as much time to do the long-term work. So I think part of what you're saying is like, how do we get people, off of these programs and how do we like move folks along on the prosperity continuum? We're constantly, collecting that data and evaluating it because we have to and we want to. We also do a customer satisfaction survey every year, so making sure that, folks do feel like their needs are being met. We ask them what else they might need. So there's a lot of, and the chief strategy officer that I mentioned is the one who's responsible for collecting all that data and then parsing it out and figuring out what it means. And we work with a lot of organizations do community needs assessments as well. So we're working with Lancaster General Hospital, we're working with the United Way, and sort of compiling all the data across sectors to make sure that we're not missing anything too. All right, well, thank you, everyone.